Primary healthcare is the foundation of healthcare in any society. One of the reasons why healthcare in Nigeria is so bad is because we don't prioritize primary healthcare in Nigeria. And by primary healthcare, I mean healthcare at the level of the community. You see all those clinics, health centers we see in Nigeria that are largely dysfunctional. Those health centers in the communities, in the small towns, villages, those are the primary healthcare, centers. A lot of the funding is mismanaged. We don't have enough doctors, we don't have enough nurses. And when you look at a country like the UK that has the NHS, as much as the NHS is going down because of funding problems, but the structure and of the NHS is such a perfect system that clearly depicts the importance of a primary healthcare system where people can have that close proximity with their doctors, nurses, and other healthcare providers. Their health can be monitored, health problems can be detected on time, hypertension, diabetes, even cancers can be detected on time, and then treatment started. Now in Nigeria, in 2025, the life expectancy of a Nigerian living in Nigeria is an average of 54 years. That is abysmal. The global life expectancy is 70 to 73 years. In Nigeria, for people living in Nigeria, is 54 years. That is abysmal. We must prioritize primary health care. Otherwise, a lot of people will continue to die from largely preventable diseases and illnesses. A lot of people continue to suffer. A lot of people have died from complications of diabetes, hypertension, they develop stroke, heart attack, and there's nothing that can be done to prevent or to in terms of prevention, early prevention of these problems. So primary health care must be developed and prioritized by the Nigerian government. The Nigerian government has to develop the country. No other person, United Nations, World Health Organization, no other person, no foreigner is coming to develop the Nigerian health sector for us, for our people. It has to be the Nigerian government that has to take up that responsibility, stop mismanaging funds, make sure you begin to build more clinics, channel funding into those clinics, make sure there are enough doctors, nurses, pharmacists, other healthcare professionals, make sure there are the necessary equipment, laboratory supports, to aid diagnosis, electricity, IT. These things have to be put in place so that we have an interconnected primary healthcare system, so that even when people travel, they can still have access to their health records.